So now we're again going to describe a very, very common scenario. So this would be a trainee who's very distressed. Again, it's going to be an ethical, moral, and a little bit of a legal take on a very distressing situation for trainees, especially the younger ones. As you get older, you get less distressed, unfortunately, and you'll understand why I mean unfortunately. So the generic case starts with the patient. The patient is being maintained on a life-prolonging intervention. It could be like he has an increased intracranial pressure for all sorts of things. The most common thing would be an enlarging mass or hematoma, and they can't do anything about it. So it's like a brain tumor, brain cancer, and these things, when they grow very large, very painful, and you might even get all sorts of neurological things like seizures and delirium, and you don't just pass out right away. That would be the end point. But before that, you're very, very miserable. Or someone whose blood pressure is going down. And of course, when your blood pressure goes down, your circulation goes down to your heart, to your head, and to all parts of your body. So you don't just lose consciousness right away. You first experience all of it. Poor circulation in the brain. You get seizures, delirium, and confusion. It's not a very fun thing. These are not very fun things to experience. You can get chest pains because you'll have poor circulation to your coronaries. You have like heart pains and things like that. You might have a kidney problem while you're still awake and you're bloated, and a failing kidney brings about terrible symptoms. It's uremia and fluid retention and everything else. And so you experience all these things, and the interventions that they're giving you, the inotropes, to the medications to keep your blood pressure up, is trying to keep those at bay, but they're also prolonging your life. Or you cannot breathe, and cannot breathe means imagine yourself drowning, but you don't just drown in a few minutes. You actually drown for several hours, and that is what you're feeling. So it's one of the worst things to experience, and you don't just pass out. Your oxygen just goes down, and even if your oxygen is 90% or 80%, you're still kind of awake, and so you feel like you're drowning or gasping, and then your brain is all fuzzy. You might get all sorts of weird sensations every now and then, and the tube down your throat and the ventilator makes you feel normal because oxygen's going inside you and you're feeling better, but you're attached to a ventilator and there's a tube down your throat. And the scenario is, this has been going on for quite a while, and the doctors ran out of ways or ideas, and they cannot reverse the progression of the disease or the diseases that's going to ultimately kill you, maybe in a few days or maybe in 1 or 2 weeks. And this is where the story becomes very distressing for the young trainees. Someone comes up with an idea. A suggestion was made to convince them to agree to the removal of the life-prolonging measure, or removal of the ventilator that's pumping in air, oxygen into them, or shutting down the thing that's keeping the blood pressure up and their circulation up, or the medication like mannitol, the thing that's keeping the pressure in their brain down. And sometimes it can even go as far as agreeing to going home. You shut these things down, and then you go ride your car or a hired van, and you go home because you refused these measures that we should be giving you inside the hospital. So you're refusing that. So what's the point of being in the hospital when you refuse what the doctors want to do in order to keep you stable and prolong your life, right? So in more formal terms, if you're the patient, they want to get an informed consent from you to withhold or withdraw, because they're already giving it. So withdraw life-prolonging measures. Withhold would be like if in the process you suddenly go into cardiac arrest, and withhold CPR. Of course, it wouldn't make sense. You want those things out, and then you go into cardiac arrest and you want them to resuscitate you. It doesn't follow. So to withhold the CPR and the resuscitation, and to withdraw the stuff they're doing to you. Now, going home, be home against medical advice, and it's to withdraw hospital care and go home. So home against medical advice, because on paper, the reason why you're signing it from a legal perspective is the institution or the doctors in the institution do not want to be liable for doing something that they feel they shouldn't be doing. Like, you probably are exposing yourself at risk, or for this case, you're going to clearly suffer and die if you go home right now. And of course, we cannot keep you in the hospital against your will, not unless you're not thinking clearly, like severely distressed or psychotic or very delirious, in which case nobody should be following what you want, because of course that's an invalid consent. It's an incompetent state, right? They either wait for you to become competent, or they ask your next of kin, which is usually what the law requires, the one who knows you the most, to decide for you based on how well they know you. And then of course we say, well, what's so distressing about that? Well, first off, for at least 3 or 4 years, the young trainee has been receiving lectures on how to cure diseases, prolong life, or extend life. I mean, and you've been taught this in school, and suddenly here you are withholding or withdrawing those things you've been told to do. It just doesn't make sense. And it's not just that. I mean, these things are keeping this person alive, or people alive, and that's something different. And you only get to encounter those things third year or fourth year. I mean, you probably encounter those things when somebody stood up there and gave you a lecture on ethics, or like 1 or 2 lectures, but it's not the kind of thing you remember, especially if you're drowning in all sorts of difficult to memorize stuff like biochemistry, pathology, the highly technical clinical lectures of your other consultants, which is probably more interesting to you when you're first year, second year, or third year, right? Compared to ethics and law. So this is something new. Now, going home against medical advice, it's something new, because in your mind, I mean, why would a person want to do that? You're thinking you'll be a doctor, you'll help someone, and then you can keep this person alive, and suddenly this person is refusing your care. That's something new. Now, related to that, because, first year, second year, you're just entering the environment of medicine, would be something that goes against your belief. If you're in a Christian or Catholic country or environment, as far as what's right and good. So here you are, and in your mind, it's the most precious thing, life, right? So, and you don't even need to go through the religion subject to figure that one out, right? And this person is refusing something that would prolong his life. And what's the second most important thing? Well, usually family. And here's the person who wants you to do something, or wants to do something that would end his life and end his relations with his family. It's not the kind of thing that's pretty easy to swallow for a very young trainee just entering the world of medical care, right? So that's another form of distress. Now, it would be a lot easier if the person was already dead. I mean, there's no harm done, there's no life anymore. Now, brain dead is something that you need to learn, because first you have to be convinced that if the brain is not working, I mean, as far as we can tell, you can't really tell, but like electrodes or whatnot, and it's not working. And you say, well, brain's not working. Of course, you can question whether that's really true or not. I mean, how can you tell if the person is still conscious, even if your mode of detecting activity is not detecting anything? Nothing's perfect, right? So anyway, if assuming that the brain's really shut down, but the heart and the lungs are working, is that person almost as good as dead? In most societies, everyone thinks it's really the body shutting down. If the heart is working, if you're breathing, it's just that you're not thinking, then you're still alive. Well, for the past, I guess, about 50 to 70 years, an argument was made that, you're practically dead. Your body's alive, but what's a body without the brain? This is a very tricky argument. It's not like a very obvious thing. It didn't get there that easily, and people were debating. I mean, how can you tell this body is still alive? How can you say that? And we won't go there, because that would take at least 30 to 40 minutes of discussion. That's not the topic for today. But let's make this case more tricky. This case is someone who's not brain dead, and obviously someone who's not dead. This one is less than brain dead, delirious, unconscious, not responding, but still, that the brain is thinking something, and so not brain dead. The worst case scenario is the person is just comfortable, wanting to go home for some reason. And then that's very distressing for young trainees, even for older trainees, if they manage to keep their sense of morality intact after they go through training. Of course, it depends on the country, or it depends on the institution or the people he's exposed to, right? Or the culture he's exposed to. What's another thing that would bother them? Well, the fact that the person is lying down there, very, very sick, terminal, about to die in a few days or a few weeks, even if you keep this intervention going that's trying to stabilize him and prolong his life, why do you feel bad if you're going to do such a thing to this person? Because this person, unlike you or your family or everyone else in the hospital, is more vulnerable than anyone else. More vulnerable than the people we consider vulnerable, like the poor, the elderly, the disabled. The most vulnerable person, or these are the most vulnerable people there are. And we're going to do something that would clearly end their life and cause suffering. That's kind of difficult to swallow also for young trainees looking at it for the first time, right? So from a legal standpoint, that's actually also very difficult to swallow. The wrongdoing that takes away the rights or does something wrong to another person is at least a civil case or civil liability. It's a wrongdoing, intentional tort, right? So you intentionally did something. Now factor in the fact that this person is vulnerable. That's one case on top of the other. So, right? I wouldn't be surprised if a criminal case can be added onto that. So, well, that's as much law as we'll say about that. It's, consultants and doctors and a lot of people get really edgy when we talk about criminal cases and civil liabilities and tort. And then what's another thing that can distress some trainee? Well, they're not just vulnerable because they're dying and they're lying in bed and those kinds of things. They're also vulnerable because usually, so you're dealing with someone whose resources are running out, the poor or the newly poor, right? And usually if you come down with a very advanced, gradually progressive, life-threatening illness, you probably have ended up using all your resources or most of your resources paying for the hospital bills and the treatment, your early attempts to cure this disease because you don't want to die, and paying all the doctors and the expensive medications and technology, right? So medicines become more and more expensive right now. And of course, we can always question whether it actually is improving the general health of everyone. And the answer is no. We're just coming up with more and more expensive stuff to treat the very sick. And we're not doing a lot to prevent them from getting there, right? So I would guess for most countries, even in developed countries, middle class down, you probably will ultimately be low on resource. You'll probably end up being poorer. And so you have poverty adding on to the mix, right? So now, before we proceed with the case, I can give you a short story about poverty just to let you know, and just to give you a glaring example why poverty is important in dealing with informed decision making. In many very poor, low resource countries or low resource communities, you can get people saying stuff like, remove everything. Me and my family knows that I'll probably live longer and I'm probably going to be more comfortable in the hospital, even if I'm going to live for only 3 days. I mean, you can give me morphine and the things that's keeping me stable right now, and I can die peacefully, but I don't want that. Remove everything and just let me go. I'll sign any piece of paper that you would want to give me. And of course, in low resource settings, sometimes you're glad that they go home, and you wouldn't ask why, but sometimes they do tell you. And the reason for that is, in many countries suffering from either maldistribution of resources or really low resources, when you die inside the hospital, they have these laws. You shouldn't be transporting dead bodies using your own private vehicle. That would be wrong for all sorts of many reasons. So you have to get someone, or a funeral service or a transport service specifically for dead bodies. Now, if you're dealing with very poor people, they might not have that money. And I've heard stories like that, because why do you want to do that? Why do you want to suffer that much when you're comfortable here? Why do you want to subject your spouse to the sight of you dying inside your car. It just doesn't make sense. And the answer is, I know I'm going to suffer. I know my family, my wife who's watching me will probably get traumatized at the sight of me gasping for breath. We don't have any money to pay transport services. If we do that, we might not even have any money for the wake, and we might not even have money to bury me. Just put us in the car and, we'll just keep on going. My wife will watch me die inside the car. We won't tell anyone that I'm already dead. And I'll probably suffer a lot, and my wife will probably be traumatized for the rest of their life, but we don't have any choice. Why? Because, we don't have money. We're poor. So, poverty makes you vulnerable. Poverty interferes with informed decision making. Removing, like prolonging measures, withholding treatment that seems to make sense. The question is, was there a choice? You can only do a decent informed consent if you actually have a choice, right? So I know I can stay. I know I can go home. I choose to go home, right? I know I can keep this. I know I may not keep this. I choose not to keep the ventilator. What if you cannot afford the ventilator? What if you cannot afford care? You're actually being coerced into a decision by your own poverty, right? There might not be any solution to the situation. It's distressing for the students, or it's distressing for the trainee if they look around their country and the government would be spending for this and that, and maybe even institutions would be spending for this and that, while the people inside the institution are going through hell, right? So anyway, we'll stop there because that's becoming very controversial already. Okay, so we'll stop there. So the bottom line is lack of resources. So poverty itself interferes with autonomy, interferes with this idea of upholding self-determination and autonomy. Now, there's also the issue of getting the consent, okay? The dishonesty issue. That's what I would call it. Let me give you 2 or 3 examples. I probably cannot go more than 2 or 3 because actually even narrating them leaves a really bad taste in the mouth. But I'll try. So we're dealing with someone who's not brain dead. You can actually talk to them, which makes the situation worse. Terminal, they're about to die in, let's say, 5 to 7 days or 1 to 2 weeks. And of course, if you remove the life prolonging measure, like you remove the ventilator, or you stop the mannitol, or you stop the initol, they die soon. Like, it will be a surprise if they last more than 2 days. And one example is, why keep this up? You're breathing, you're awake, you're with your family, but then your other family members are at home. You're going to be dying in the hospital in the next 1 to 2 weeks. Would you rather spend your final days with all your loved ones in your own home and die peacefully at home, and die at home with your family? Your life might be shortened. Instead of being alive in 2 weeks, you might just be alive in 5 to 6 days or 1 week. But don't you want that? Wouldn't that be better? We'll follow what you want. Of course, what's your answer to that? I mean, most of you would say, well, yeah, I'll take it. I mean, my wife is with me right now, or my spouse is with me right now, but my children and my relatives are down there in the province, 2 to 3 hours away. I'd rather be there. Or I'd rather be there than in the hospital ward or in the hospital room. The other one is, to stay here longer in the hospital, you might end up with an infection. You're on a ventilator right now, or you're immune compromised. You might get a hospital-acquired infection. Or if you're on a ventilator, that's even worse. You're really prone to a hospital-acquired infection. You'll be sick, you'll have fever, and they'll try to cure you. You might be able to control it, but then you'll have an infection again. Would you rather experience that, or, just go home so that you don't die because of the hospital-acquired infection? Okay. The last one, so I think I can only do 3 because it's becoming very difficult to swallow. But anyway, last one, which is the worst one. I never thought I'll hear it, but it actually happens. Unfortunately, this is how it goes. You have a tube down your throat, and you're awake, and your family members around you, but you can't talk to them, and it's uncomfortable. This tube is preventing you from speaking. Would you rather have this tube out so that you can talk to your loved ones, to your kids and your spouse who are beside you, say your final goodbyes? So would you rather have that? Now, what's the problem with that? Some of you might actually listen to it and say, hey, yeah, I mean, that makes sense. Now, if you're one of those, you probably heard it before, or you probably delivered those things before. The younger you are, the more uncomfortable those things get. Why? Because they're dishonest. They're not the complete messages. And remember, because doctors are the ones saying those things, that the patient can get heavily influenced by what's being said. Like, for example, let's take this tube out, because, if the tube is out, then you can talk to your family members. It sounds good, right? But your respiratory failure, the reason why you have a tube down your throat and you're on a ventilator is because you cannot breathe. If you take this tube out, what will actually happen is you'll be gasping for breath, you'll be delirious, you can barely talk to your family members, and they'll be looking at you, traumatized at the sight of you, as you die in distress with the tube out of your throat. As compared to the tube being inside your throat, you can nod, you can listen to them, you might even be able to write on a whiteboard and live several weeks. Now, if I tell you the complete information, what would you choose, right? Because actually, an information was said in a dishonest way. When you withheld the information, the family and the patient would assume that, the tube is out and they live long and they won't be suffering. You didn't tell them that they'll be suffering, and you didn't tell them what will really happen once the tube is out. Now, going to the family in the province, 2 to 3 hours away, don't you want to be there? You might die earlier, maybe 1 week, but at least you're with family and you're talking to them, and wouldn't that be good? Now, the problem with that is we take all these things out. What's not being said is we don't think you'll make it home. You'll probably still be in the freeway or in the expressway, dying inside the vehicle. So what's that? That's a lie. They'll assume, well, the doctor says I can actually go home and be with my family if I decide on this. That's the reason why you chose to go home, right? And the other one is go home so that you don't have hospital-acquired pneumonia. You experience fever and you have an infection, we might be able to treat you, but why risk it? Just go home and you won't have pneumonia, right? But the problem with that is, if you go home and we take out your ventilator or your life-sustaining measures, probably you won't have pneumonia, but you'll be dead. Now, we didn't tell you that, right? Now, all these things, the worst cases, and as you noticed, the worst cases involve what I call the evil twin, the evil twins. Okay. The evil twins is you put a dishonest or invalid home against advice together with a dishonest or malicious or invalid withholding or withdrawing life-prolonging measures and withdrawing care. And you have to put them together to kick the patient out of the hospital. Why? Because if you don't have home against medical advice and you remove all these things inside the hospital, and then the patient and the family would realize what's wrong with the decision. Of course, they actually probably sue you because you didn't tell them that this would happen to them. And the way you said, you informed them, they thought it was going to be nice and cuddly and warm, and they'll be talking to their family, and suddenly they're gasping and uncomfortable with a severe headache because the manic was gone and seizures, and suddenly the family's traumatized at the sight of a dying family member who's probably not going to last the day, maybe 1 or 2 days if you're lucky, right? So you have to partner that. If you put them together, of course, they become twins. Now, why are they evil? Well, historically, those two things went through a lot of debate. I mean, they're not obvious. People were arguing back and forth whether it's actually moral or ethical, and they have real concerns and fears about these two. And the reason why home against medical advice got approved is because the idea is you really have someone in the hospital who's not about to die, who's not attached to any life-prolonging measure. It's just that the doctors are offering him or her all these things to treat him, and he doesn't want it. So the idea when it got approved is you have someone who wants to go home, and the doctors think they can still prolong his life and he will die quicker when he goes home or he puts himself at risk. But it's not someone who's going to die in the next several hours, or at least within the next 2 days. That wasn't part of the plan. Withdrawing life-prolonging measures, like someone's attached to a ventilator, someone who cannot breathe, gasping for breath, and then you put in the ET tube and the ventilator, and suddenly the guy is breathing, still with terminal illness, or someone is with increasing intracranial pressure, like a brain cancer, and then you are giving mannitol and dexamethasone, and you've controlled the pressure. Or someone who has a reason for the blood pressure to drop, like a failing heart, and then you give this person inotropes, you titrate it well, and then suddenly you have someone stable, or relatively stable. Now, the idea behind that is this person says that he doesn't want to live that way, and can you please take it out? And then the worst case scenario is this is the only thing that's keeping him alive, or 1, 2, or 3 of these things are the ones keeping him alive. And you take these out, this person will die in the next few hours, or won't last 1 or 2 days. This was a harder sell. I mean, why are you going to do that? Obviously, you are capable of giving this guy that intervention. What made you decide to take it out? And the only acceptable reason is because the guy wants it out. So autonomy and self-determination is always at the forefront. Home against medical advice and withholding life-prolonging measures. Now, the thing that got approved is you have to make sure that you do everything that you can so that this guy doesn't suffer terribly when you took out the ventilator. You just took out his air. The reason why he is on ventilator is because he cannot breathe, right? Or you have to make sure that that severe headache of his and everything that comes after you stop the mannitol doesn't happen. And maybe you shouldn't stop the mannitol. Now let's focus on the extubation, because that's the thing that ends up with certain death. So the thing that got approved is, we approved this, but you have to show us that you're really going to try to make sure that this person doesn't suffer. That's the reason why you don't send people home. Home against medical advice. You don't send people home once you take out their air. I mean, there's no way you can control all the suffering that will follow inside an ambulance. And why would you do that when you can guarantee better comfort when he's inside the hospital? These two weren't meant to be used together. Now the question is, how come in some countries you always see them together? Because they are being used for some other reason. In a very corrupted society, the very smart, creative, but corrupted minds realized that a corrupted version of withholding life-prolonging measure plus a corrupted version of home against medical advice is a great way of kicking people out of the hospital in a somewhat legal-looking manner. All you need to do is convince them in whatever way, as long as they sign the paper, and then you partner the two. You partner the withdrawing of care with the immediate home against medical advice. And that's the reason why you have the evil twin. These two are clearly not meant to be used together because the intention is wrong. These two didn't get approved with that kind of intent in mind. Society, after much debate and much concerns expressed, agreed to home against medical advice and agreed to withdrawing life-prolonging measures with a different intent. Now, I'm pretty sure those people who approved these things weren't thinking of using them together in such a manner that's very, very corrupt, in a way to kick people out of the hospital, take out the intervention from a patient, and kick this same patient out of the hospital. That's the reason why I call them the evil twins, because only a very, very corrupt mind would use these two separate things together in such a very morally corrupt manner. Of course, the rule is, if you're already too far gone, you're already morally corrupt as a care provider, then you're following the golden rule. The golden rule is, it's not illegal if you don't get caught, or it's righteous as long as nobody sees it. So you have to partner that withholding of those measures with home against medical advice. So the trick is, they sign both at the same time. You take those things out, you put them immediately in the vehicle, their vehicle, and then you see them off. So what happens after that, though, that's none of your concern. You didn't see it, and they're the ones who decided on it. It's not your fault. Actually, it's your fault, but on paper, it doesn't look like it. You know, they understood. You informed them well. Now, that's questionable, but on paper it says you informed them well, and they signed it. So you took those measures out. And you took the ventilator or the mannitol or the inotrope or whatnot, including the morphine. Okay, so now if there's still some humanity left in you, who would want to give the morphine to the patient while he's dying, but you have to partner it with home against medical advice. They're refusing care, and therefore, after they sign the home against medical advice, you cannot give the morphine anymore, right? So that's how the legalities of it work. They refuse care. So, but you need the Hama because home against medical advice, because once you remove those things, you want them in the car right away, so that when the bad stuff happens, they're already out of your place or out of your care. And then you wash your hands and tell everyone it's not your fault, or you have no idea what's happening, and you probably shouldn't make an effort to figure out what's happening. For many hospitals in developing countries or very poor countries, sometimes the hospice people are only good as far as helping out in the hospital, maybe helping out with decision making. Hopefully they're not part of the evil twin scenario, or they might be, but they cannot really do any hospice care outside of the hospital. They just don't have any resources. The institution doesn't think they're that important. So you suffer along the way without any hospice care. And even if there is hospice care, they cannot do that. Why? Because they made you sign home against medical advice. Now, the problem with these situations is usually if it's a very rich, well-resourced country, you don't resort to these kinds of dishonesty to make the people sign the paper to make it legitimate or legal looking. Obviously, it's not. I mean, it's an invalid consent. Make it legal looking, or make it look right, to make the action look right. They signed home against medical advice. They signed the consent to withhold and withdraw. Now, let me repeat it. If you do that, that's dishonesty. That's one case against you. You did it, and the result is the patient decided wrongly, and it resulted in his suffering and death. That's like several other cases against you. That's probably more than just a civil liability. There's probably criminal cases that can be stacked up against you. But just be careful. And of course, I won't go further into the legal thing. That's not our topic right now. We might do that one of these days, but doctors don't want to hear that too much. They get really edgy, so we'll stop there. Now, some of you, especially the very young, probably shaking their heads right now. And some of you would even say, how can people be idiots, right? Really foolish. But that's not really true. I mean, they know what they're saying. They know that if you remove the tube, they'll suffer more and they'll die earlier. This argument about not getting infection inside the hospital, it's better to go home. They're smart enough. I mean, even grade schoolers can figure that one out. So, I mean, how can you be a doctor if you cannot figure that one out? So, really, it's not a question of people who are idiotic or unintelligent. It's actually the other way around. Doctors are decently smart. That's the reason why they went through med school and they were able to pass through med school, memorizing and understanding of all sorts of very, very technical stuff. So they know what they're saying, and they know what they're doing, and they know that it's incomplete information, and they know what's happening. So it's not a question of intelligence. It's a question of morality, their sense of what's right and what's wrong, and what's good and what's bad. For some reason, in their mind, it's okay for them to do this to the patient and to the patient's family. And the reason why the trainee is distressed is because their sense of right and wrong, good or bad, is not there yet. So it hasn't changed that much yet. There's something in these stories that doesn't feel right. Of course, the older you are, the more training you get, the more palatable it becomes. A very concerning thing. The question is, as you go through med school and as you go through further training, as you get exposed more and more to the world of medicine, you become a young consultant and so forth, are you becoming more and more desensitized to wrongdoing, to things which are unrighteous? Are you becoming more and more desensitized to malevolence, to evil? Is unrighteousness, evil, or malevolence, or wrongdoing to a fellow human being becoming more and more normal to you? Is it becoming more and more normalized as far as you're concerned? Something to think about. It might be happening to you right now. You just don't know it, right? So these things actually creep up on you while you're having such a stressful time trying to survive and trying to pass all your very difficult medical subjects or nursing subjects and courses. But what would make doctors do those things? Well, it's obviously illegal, right? So, I mean, why would you try to make the person sign home against medical advice to protect you from liability if you think what you're doing is perfectly legal? Why would you lie to make the patient sign? Because without the signature, you don't think you can actually remove the life-sustaining measures. And you don't think it's going to be very legal for you to send the patient home on an order, knowing that the patient will die and it's very unstable and actually has to be in the hospital. It's his right to be in the hospital, right? So knowing that you're actually removing the rights of this very, very sick, vulnerable person. So you say all these half-truths and dishonest things to make the person sign was actually an invalid consent, but who would know, right? But you have that piece of paper saying that he actually thought about it and he consented, and in your mind that would protect you. Okay? And why would you do that? Because you think, well, the only reason why you'll do that is because you think you're above the law, right? The law is wrong. Now, my suggestion is, if you think the law is wrong and you think it doesn't follow your sense of ethics and morality, then you go to your lawmaking body and convince your congressmen and senators or your representatives to change the law to make it legal, right? So the reason why you're not doing that is because you know that everyone else in the country probably don't think so. You feel like you're above the law. Now, is it ethical or is it legal? Well, if you go to your code of ethics, which is the go-to document in most countries, if it's an ethical issue, most codes of ethics in several countries would say an ethical doctor follows the law. Well, why? Because the law in theory, comes out of the moral ideals of the majority of society, right? So now, if you believe otherwise and you have this different sense of morality compared to the majority, you don't have any right to enforce that, especially on a person who doesn't agree with you. You don't have the right to break the law. I mean, that's not an excuse to break the law, right? So what you should do is you should try to convince everyone in society to agree with you, to see your point, and then you change the law. That's the way to do it. You don't just break the law and then tell your colleagues that it's right to do so, or tell students it's right to do so because you think it's wrong. The law is wrong. Don't do that, especially if you're an educator. That's like morally corrupting young minds. And if you're a Christian or Catholic, you know what the scriptures say about corrupting the young or the children or the young minds. Okay. Now, the other thing that would be noticeable is a lot of times the doctors who actually say such things wouldn't want that thing done to them, right? If they're the ones who are sick and lying down inside the hospital, of course they're going to be in a fancier hospital because they're rich or they're doctors. They wouldn't want the hospital or the doctors to give them such a statement, you should go home. And of course they won't believe it because they themselves have been saying it, but they don't want anyone to withhold information or lie to them. They wouldn't want that, right? So what does that mean? You, the doctor, think you're above your patients. Okay, so the kind of care you want for yourself is not the kind of care your patients would get from you. So the kind of care that you would want for yourself if you're the one who's lying down on that bed in that situation is not the kind of care you would want to give this patient. It's not the kind of care you think your patient deserves, right? So again, if you have a Christian or a Catholic or actually almost any major religion would probably say it, moral ideals based on your religious beliefs. What do you think about wanting something done to you, but you not doing it to the other person, especially to the one you're supposed to take care of? What does it say about the stuff that you don't want people to do to you, and you doing it to your patient, the one you're supposed to be taking care of? you doing it to your neighbor or to your brethren. Now, you can go on from there. I'll leave it at that. But for most religions, it's really a major source of concern. You should probably sit down and really think about what you're doing. Finally, we come to the most basic concern, which is also the thing that probably causes the most distress, or the core issue that causes distress to a very, very young trainee seeing these things for the first time. It seems like you're not caring for the patient. I mean, doing all these things to your patient who's very sick, is suffering, is dying, to convince them to agree to something that would make them suffer more and die earlier, doesn't seem like an act of someone who cares. Now, why? Because in most societies, Christian, Catholic, actually any major religion, you feel like, if you have the virtue of love, it should manifest as caring for other people or your brethren. Love should manifest as caring. And uncaring, not caring, is the opposite of love, right? And I think Christian, Catholic, or in most religions, love is a very important thing. Love, charity, and caring are very important things. I don't think you'll go to the right place if you don't have those. I mean, even if you do medical missions every day, or even if you donate a few $1,000 that you can easily afford to charity, I don't think that will buy you a ticket to the right place, right? So something to think about before it's too late, if you have those kinds of religious beliefs or ideals, right?